Welcome to this module on delegation. The following information applies to you if you are a registered respiratory therapist in Ontario and your certificate is clear of terms, conditions, or limitations. Keep in mind that some workplaces may have additional policies, procedures, or legislation, but here are the basics. Under the Respiratory Therapy Act, you have tools in your toolbox referred to as authorized acts. While you have the legal authority to use these tools, you must always ensure you have the knowledge, skills, and judgment to use them safely. The same requirement to be competent applies to the process of delegation. Just like you, each regulated health professional has their own set of tools that they are legislatively authorized to use. They can, under certain conditions, lend or delegate the use of their tools to you. The delegator must have the legislative authority and the competency to perform the act themselves. All the same things you need when using your own tools are required when using another healthcare professional's tools. You still need an order, either a direct order or a medical directive. You still need to document clearly and completely, and you must still be performing procedures that are within your scope of practice. And most importantly, you need to be competent to perform the task or tasks required. Delegation is a formal process. Someone asking or instructing you to perform an authorized act at the bedside does not constitute delegation nor the legal transfer of their authority to you. This is because a key component of the delegation process is education. Before you use that borrowed tool for the first time, it is essential that you have undergone the training necessary to ensure you can use it safely. Performing a task under delegation is also not the same as assisting. You can assist someone who is performing a procedure that is not in your toolbox without delegation, and keep in mind that most employers will have policies and procedures regarding both giving and receiving delegation. Always check your employer's policies, and just as a reminder, this information applies to registered respiratory therapists without terms, conditions, or limitations regarding delegation. Like any good practitioner, you are expected to use your tools wisely, borrow tools when appropriate, when the task is within your scope of practice, and when you feel competent to use the borrowed tool. Lend your tools when it promotes patient safety, facilitates access to care, and allows for more timely or efficient services. Remember, it is what is in the best interest of the patient that is important. Of course, there's always more to know. Additional details are available on the CRTO's website or from your employer, but I hope this helped clarify delegation as it applies to regulated health professionals. Thank you for your attention. Bye for now.